Good evening, everyone. Welcome to our podcast on deliverance tonight. I'm so grateful that you have decided to join us again, and what an exciting time to be here in this program. We mentioned to you that deliverance is really not only about dealing with health disparities and health challenges in minority communities, but deliverance is also an acronym, and each letter has a profound meaning. We will unpack each one of the letters, and we will discover how each letter helps us to accomplish our end goal of being delivered and be able to experience holistic health and living. Well, I mentioned to you when we first started that I would have guests coming on each time we meet, and tonight I am ecstatic that we have as our first guest on the Deliverance podcast a profound expert, an individual who has so much to say about health disparities and minority health. I want to introduce to you Dr. Antoinette Percy-Laurry. She is a health scientist administrator from the Office of Science, Policy, and Planning and Evaluation and Reporting for the NIH. She comes with an extensive background in research and looking at minority health challenges in Black and Brown communities. She's a professor, she's an educator, she's a teacher, she's an administrator. She's just a phenomenal woman of God, and we're just excited to have her with us this evening. In addition to her service, she also does a lot for the community at large. I mentioned she also is a captain in the Health Services Office of the United States Public Health Service Commission Corps. So we're excited for all that she brings to us. And I can talk about her all day because I'm just excited to have her here tonight. Thank you for joining us, Dr. Laurry. I call her Antoinette also, but I'm just so glad to have you with us this evening.
Thank you. Thank you for having me. I do want to put the disclaimer that my words will be my own and they are not representing the federal government. So I have to make that clear that this discussion will be from my personal experience and background.
Wonderful, wonderful. That's what we need. This is for us. It's like us sitting around the table at a meal, having a conversation about things that we are passionate about. So since we're dealing with deliverance and we want to start with our first letter, which is D, I think is the most significant way to start. For deliverance, D represents data or data. And, so we look at data. It's been said that information is power. But my question to you, first of all, is what is data?
Sure. So data are collection of factual information that are numerical or non-numerical, as in written text, can visually be shown in images, graphs, statistics, and typically need to be analyzed and interpreted. So that's the short form of that definition.
Wow. Oh, okay. There's a whole lot to that short form definition.
Well, I say that because there are general types of data. You have, when you separate qualitative from quantitative data, you have a different meaning of what you can get and how research is conducted based on those two types of data. The quantitative is the numbers, right? The counting, the statistics. You can measure something, you're able to compare groups. And an example could be the number of people diagnosed with COVID. That's a number. You can compare white population diagnosed with COVID versus the Black population, what that number looks like. So that's your quantitative data. And then you have your qualitative data, which is the non-numerical, as I mentioned before, which is your text form. And so, much of that comes from observation, also from methods like interviewing or focus groups or just listening and getting feedback from from patients, from participants. And an example could be, you ask the question, why are folks being diagnosed with COVID? Why some have higher rates than others? Why are you not getting the vaccine? That's a typical question, right? Why are you not getting the vaccine? Why are the rates so low in the Black population? Then you will get the details. You'll get rich details from the person or groups explaining why. And then you are able to analyze what needs to be done based on they're explaining their behavior or concept. So that's the qualitative data.
Thank you for that broad and deep explanation. That's why you are the expert. But you mentioned some things that's going to segue into my second question, because I know that you are passionate about minority health. You're also passionate about health disparities and et cetera. And that's what Deliverance is about. That's why we were talking about data. So my second question to you is, why is knowing your data important to one's health? What is it about knowing as much information, and why does it matter?
That's a very good question, Pastor. Right off the bat, I think of empowerment. And knowing your own data is empowerment. You're becoming an advocate for yourself, a better understanding of yourself, determining your own health goals, and making decisions about your own health. One thing I want to bring across is that when people think of health data, many times they think of what's in their medical record, what's in their doctor's office. But there's also non-medical factors that influence health, factors that are outside of our control, yet preventable. And examples are childhood traumas, food insecurity, social justice, access to quality education, discrimination, poverty, employment, exposure to violence, historic legislation, and unfair social and economic policies, right? So those are things that are outside of our control, but they do impact our health. So, assessing what influences our health decisions is something that we need to know, and something that we need to do, rather. So knowing our health will make us be able to assess make some decisions about our health, assess what influences us, and make some better decisions about our health.
Wow, that is a profound answer, because you not only talked about the individual, we think about medical records, knowing your health history, but you just expanded what that really is. And that is something that we need to pay attention to, how you just explained it to us, which leads, and we can circle back to this while we're talking, because, we can expound upon it, because, while you were talking, I was thinking about, even when individuals visit their primary health care or others, and sometimes when they ask about, do you have any questions? Why is it that we don't have any questions? Which is leading to my third question to you. And that is, why do people withhold personal data from family and others, or don't ask for enough data when they have opportunities to?
That's another good question. And research has shown that in the Black community, we ask less questions compared to our white counterparts. Sometimes we don't know what to ask. It's not necessarily that we, don't care, but we don't know what to ask. We're not exposed to asking, and sometimes there's that trust factor, right? Historically, we don't trust the health community necessarily because of what has happened in the past. But as far as holding personal data, say from family members, there is self-stigma of not being 100% healthy. There is that self-stigma. There's a level of stigmatization of having too many health problems or a specific health issue. Some folks are embarrassed. No one wants to be sick. No one wants to burden their family, or most people don't want to burden their families. And so, they don't want their health issues used negatively against them as well. So there is a trust factor, it's, privacy issue, and also culturally, depends on the culture of what they have experienced and what they're taught to do in terms of hiding their personal health from others.
Wow, I've seen that, what you've described there. I know
Yeah.
I've seen cases of it when individuals were getting married,
Mm.
histories that would withhold from one person, and after marriage, things were discovered, especially in the area I've seen in mental health challenges and so forth, and just either the denial or just not wanting to disclose things, and what that means. Anything you want to add to that?
Yeah, it is important to share this, your personal information with close family members, because it helps with decision making, especially when you're older. And we need to think about the future and those around us who can help us to make some decisions when when we're at a certain point in life where we're not able to make decisions on our own. And there are also genetics may play a role in terms of identifying what the DNA that we have, what may be similar among family members. Certain diseases, maybe we're susceptible to certain illnesses or diseases, and if caught early, we can prevent illness or long-term illness. So those are things that we have to think about when we are given personal information about our health that may help others to help us. Think about this as helping yourself as well, right?
So I'm hearing you, before I segue to still another question, what I'm hearing you say that is so important is that knowing that personal information, that data, that D in deliverance,
Mhm.
is also a way of modeling your care for others. It goes from being selfish to
Mhm.
being selfless, that the more you share with family and people close to you, is also an act of love,
Yeah,
because I'm also equipping you to know what I know. Is that
yeah,
pretty good also?
yeah. That you summed it up nicely.
Oh, thank you, thank you, thank you. But when you think about data again, Doc, there is this issue that how can disclosing so much data be used in positive ways and then in the negative ways? When you think about, you're the expert, you know how numbers, statistics, whole number versus percentages and so forth is used, you know,
Mhm.
positively and negatively. How do you speak to that? About
Uh,
what I'm disclosing is
oh,
not going to be used against me, but for
yeah, there's so much to unpack in that question. And I'm gonna start with I may have to mix the my answer with positive and negative.
sure.
Because there's so much to unpack there. Historic trauma has shaped the way we think and trust, especially as people of color, right? Data, what's positive about data, that it informs policy. Decisions are made on how to allocate funding and resources, right? Programs are developed to address the needs of the community. That's why data is very important off the bat. But we know that historic trauma is associated with data being used negatively in the African American community. That has happened, right? But we need to think about community involvement, civil rights movement, boots on the ground, whistleblowers, folks who are allies for equity to bring awareness. That has occurred, and we need to be encouraged that policies have moved toward being more ethical research, and to having more ethical research, and also having diversity and representation in data, right? Seeing ourselves in data. So, we've had, there are internal review boards that we were created, since the 70s. We have consent for research. There's so many things that have been in place due to things that have happened in the past to people of color. So things are moving in the right direction. Not to say that things are perfect, right? Still, there's work to be done. And we need to be vigilant in researching the study that we're involved in or want to get involved in. If we need to receive guidance from others, or if we have professionals we trust, you lean on those folks when you are involved in something that's requiring your data, if you have a lack of trust. Because it's important to know that for all races and ethnicities, you want to share in the benefits of new scientific discoveries. Discoveries are being, there's so many scientific discoveries, and we want to make sure that those discoveries include us. There's certain medical advances where we're thought about, and our health can be improved just like everyone else's. So I in terms of positive, we need to realize that we do need to trust, to build trust, and to not accept these misinterpretations, or I want to say misinterpretation of data. So before I get into the negative, though, I do want to say that there are racial disparities in disease burdens and healthcare and in other areas, which is the negative, part of the negative, right? We have racial disparities in home ownership and educational status and employment wages and the number of people incarcerated. I can go on and on about where there are racial disparities. But we've got to understand, when it comes to data, how did we become aware of this? How did we become aware that there are disparities and that there are, injustices and inequalities and inequities and all of these things? How? Data. Data. Someone had to go out, do the research, collect the data, analyze the data, interpret the data. That's how we know. So there are good things happening, and across the nation, across the world, and we need to trust that we are being included and we're thought of, and there are racist folks and other folks that are there trying to tear us down and think negatively about data, but then there are folks who are doing the right thing, and we've got to understand that too. In terms of understanding what needs to be done. Like, we know that there, as what I mentioned before about these racial disparities, we know that there are drivers to and determinants, those causes that are the reason for these disparities, right? And many of these causes are are considered upstream, which means they're more a higher level. They are relate to policies and injustices that are historic and perpetuated by society, right? So eliminating those inequities, we need to do that. We need to eliminate institutional racism and structural factors and systemic racism and all of that. But again, how do we know about these causes? How did we get here? How do we know that there's institutional racism? And how do we know how what to do to improve our health? It's data, whether it's qualitative data or quantitative data, records in hospitals and doctors' offices, interviews, folks, you're getting this from data. So and so now, want to end on this positive note for this, partial positive discussion about data, what can be positive about data. There is more awareness, and really what I'm doing is summing up what I just mentioned. There is more awareness about injustices, and there are more precautions in place. Example, banks are required to ask for race. so that we can assess that they're being fair in giving out loans, etc. Healthcare systems are now collecting what's called social determinants of health. Those they're collecting them and putting them in their electronic health records. All right, so that they can, and those social determinants of health are what I mentioned before, those non-medical factors, where you live, where you went to school, your zip code, employment, your wages, all of that. Those are part of social determinants of health. And a lot of the healthcare systems are collecting that now so that they can not just focus on your disease or illness, but get a full picture of that patient. So collecting, reporting, and monitoring health data, whether from the hospitals or from insurance companies, allows for assessment of progress in eliminating disparities, right? And evaluate efforts and to assess potential civil rights violations. It's very important to note.
Wow. Thank you. If you're just joining us, we are having a discussion with Captain Antoinette Percy-Laurry. She has a doctorate degree in public health. She works for the NIH, and she's a health scientist administrator, Office of Science Policy, Planning, Evaluation, and Reporting. She has been blessing us with profound information this evening. And wow, you've just opened up so many things that, one thing that came out of this last question and your profound answer is why our people need to participate in scientific research. We still get caught in the Tuskegee experiment and we run from anything that comes our way. Recently, I was speaking with someone who had a federal grant. Could have been from your office. I don't know, but the federal grant was looking at type 2 diabetes. And what was challenging that the person was going to the African-American, the Black churches, trying to find 12 families to participate in the study. And the challenge that they had trying to find enough participants before the deadline for the funding ran out. So it was in desperation that they reached out to me to see if we can get some help there. And we were just talking about the resistance, how our people just don't want to participate in those kinds of studies, although it benefits our communities and our people. So for those who will hear you in this podcast, I hope that it changes the narrative and we will understand why this is so important for us to be participants in the data that is about us, and how we got to do more of it. But let's move on because there is, yes.
I do want to add, there is negative use of data, right? In terms of, data should be ethical, but there's a potential use of data to stigmatize groups, causing harm. Historically, data were never gathered to help or serve people of color. Rarely, right? It was primarily done to show the deficits in our community, to show where there are gaps, but not to create opportunities when gaps were seen. It was done from a deficit-based framework, right? Where this is an African-American community or a Hispanic community, and these are their higher rates of obesity. These are their higher rates of, these, and so forth. This was the historic way. And some racist groups still do that, it's to bring negativity. But, and there was an example of misinterpreting data to show negativity that I have. I did have years ago, when I wasn't living in this area, in another state, I had a conversation with a non-minority person, and they were talking about poverty and welfare, the poverty and welfare gap. And of course, they pointed to, Black folks are more poor, they're more Black folks are in welfare, using up America's money, draining us. That was the conversation. There are more of them, and they're just taking up all the money. I've seen the stats, the Black percentage is so high. There's so many Black folks taking our money. But that was a misinterpretation of data, because when you look at it, it's still today, there 17% of Black folks are, below the poverty, and 10% of whites are below poverty. And you may say, well, 17% is very high, but that's 44,000 Black people, and that's close to 250,000 whites. That's the difference. I mean, yes, is it still a good thing? It's not a good thing that we have 17% of Black folks below poverty. It's not good, but because it's not good because we're a small population, and that's high for a small population. But in terms of numbers and counts, we're still a very small number of people on welfare compared to the white population. So that's wanted to give that example to show how folks can misinterpret data to show negativity because they don't like something, or they're on, whatever the issue is. So we have to be careful of how we communicate data. Wanted to make sure that that's known.
That was thank you for that analogy, that illustration. Not only is it good for others to know, but it's good for us to know. When I think about, those who watch our program, a number of them come from faith-based communities, and sometimes a number of those churches exist in impoverished areas where they commute in. And if you have a misunderstanding of the community that you're in, then it keeps you from really being engaged and really lifting up that community. So I think what you just shared is so helpful, and I can't wait for us to do this again, because there's so much you have to give for us on this critical topic, especially dealing with disparities, health challenges in Black and Brown communities. But can I move on to another question? I want to raise this question to see if we can, turn this around, because there are individuals who are watching us, are listening, and they're not public health professionals, they're not researchers, but the question always comes up for individuals, especially in this digital age, is that how do you access data for personal and then for public use? How do you get a handle on it? What do you recommend for the average person who is not trained, who's not focused on being a researcher? How do they access data for themselves to know what's going on, and even to help others?
Mm-hmm. Yeah, that's a good question. It's also so data are rather ubiquitous. They're everywhere, especially in this digital world in which we live. So it depends on what you want, right? There is national data, there's state level data, there's county level data, census tract data, small blocks, where we live. There's data from the general conference, data from your church, data on your school, data from your doctor's office. So it all depends on what it is that you're trying to, what your interest is, your purpose of trying to extract data. For the national data and state level data, those are things you can get online, even with your health department. You can Google your health department. You can also look at, on the national level, census data. There's so many, they've tried to make certain parts of their website user-friendly when it comes to data. So you can see educational level and compare different groups in the US. You can see the poverty level. You can see, incarceration. There's a lot of information there on a national level. But local data does tell more of the story and identifies gaps, where you live. So, looking to see what your health department has. And when it comes to your health data, that's your doctor, that's your doctor's office. They would have more of that, and your health insurance They capture claims, what's called claims data, when they have to pay claims for, whatever the health issue is, or just seeing your doctor. So they have your information too. So you can communicate and ask questions from your doctor's office, from your health insurance, about your own health that they have. And if you're interested in seeing what's happening at your school, maybe you have children in, in high school or junior high, and there's some things that are not quite right to you and you want further information, contact the school, talk to them, try to have a better understanding and, assess what the needs are or what the situations are. That's data. You can also do your own. You can also interview people if something is not going right or you need some changes in whatever environment, your school, your work. You can take a poll. That's data. Survey the folks around you and make some changes and make it right. You don't have to depend on the system. You can make a change yourself. So again, data is everywhere. It's in social media. It's everywhere, and it's just. If you're still unfamiliar and need help, you can connect with someone who has a better understanding of how to capture data or to log on and research and find information online, or who's brave enough to contact services or organizations in your area. So those are my suggestions.
And they're great suggestions. I hear an empowerment from those suggestions also. And, as we bring this to a close for this session, out of this, I know you and I have talked offline about the whole issue of health and medical illiteracy in our communities and so forth. And I want to hope that and pray that the empowerment that you suggested today about accessing data really begins to raise the level of education for individuals who are so intimidated, even about data on their personal health, as we talked earlier about asking questions and finding out things, not being intimidated when you're in front of your healthcare provider. When, yes, I have questions and to be able to ask those questions. So as we prepare to close this session here, again, we're talking, but talk to that individual who needs to be empowered to come out of medical illiteracy and to be empowered enough to begin to ask questions and to discover data that helps them and helps others.
To be empowered and to feel that you have the right knowledge is to read for yourself and to do research for yourself. But it starts with you wanting to do that. It starts with you caring about your health and others. You have to want this. You have to make this a priority. So is it something that you want to do? You want to know more about your health? Do you want to know about what's in your community? And, you're just trying to figure out how to, it can start with outlining what it is that you need, draft something in a document. Like, what do you want to know? What are the areas of your health or in your local community or at your church, or draft something, write something, a document what your needs are and why. And then you can start there. You can start researching online. You can connect with someone, even partner with someone. If you know someone that you trust and they may have a more knowledge in a certain area, you can collaborate with them and they can find certain things for you. And talk to your physician. Some folks, going back to what we mentioned before, some folks are there's a lack of in the Black community. There are less questions being asked in the doctor's office, and research has found that if you bring someone with you to the office, that helps. If you're to the doctor's office, that is, if you are if you're intimidated by asking questions in the doctor's office, bring someone along with you. Bring a family member or a close friend. Maybe they can. And it also goes back to making sure that you disclose your health, maybe your health issues to a family member, because then when they're with you, they can ask the appropriate questions if they know what's going on. Right. If they don't know what's going on, you're left alone, and you may be intimidated by the process and discussion with your healthcare provider. But bringing along someone with you, that's also helpful. So I would say start with jotting down your needs and what you wish to know, and start there and connect with the right people and the right organizations. If it takes organizations, I know that I've been connected before to a cancer survivorship organization where folks, would call in to get information, and those people felt empowered because they're asked questions about their loved ones, and also about themselves, if they, to get more information so they can feel empowered and understand their situation. So there are organizations out there, and people that you can collaborate and get information from.
Awesome. Awesome. Well, as we prepare to close, I can't thank you enough. For those who may have been joining us, you're wondering, who is this profound expert speaking? This is Captain Antoinette Percy-Laurry. Her PhD is in public health, and she is a health scientist administrator, the Office of Science and Policy Planning, Evaluation, and Reporting for NIH. But she has come tonight just to talk with her passion. We're just having a roundtable conversation about looking at your health, our health, and how this holistic health and how it fits into the acronym of deliverance, because that is our goal. Our goal is to deliver all of us one letter at a time, one step at a time, until we are delivered according to God's motif for deliverance in Scripture. That is our plan tonight. So, Dr. Laurry, I can't thank you enough for being with us this evening. And it is my prayer that this is not the last time. You have just touched the surface on so many other areas in deliverance that we want to talk about. But your expertise and your willingness to share this evening, after your busy schedule, your busy week, taking time to be here, we really appreciate it. And thank you very much for joining us tonight.
Thank you. Thank you for having me.
You're welcome. You're welcome. So on behalf of the Allegheny East Health Ministries Department, I want to thank you for joining us this evening. I am Anthony Medley, the Health Ministries Director for the Allegheny East Conference. And until we meet again next month on our next podcast, where we will look at our second letter, the letter E in deliverance. May God continue to bless and keep you. God has come that we may have life and have it more abundantly. In other words, God doesn't want us just to be alive. God wants us also to thrive. May God bless you as we thrive together until we meet again. Take care.